We are going to discuss the next steps for the IHE cardiology domain. Nick, with his thoughtful thinking photo there, will be discussing upcoming areas of emphasis. You'll see David Slotwiner's picture, but actually this is Nick's slide. This was a pilot error on my part. And David will be discussing the next slide. So, Nick?
Okay, so the cardiac procedure note extensions, we've covered that quite a bit already. But one of the more interesting things happening that we're doing with this CPN profile is taking a look to see if it can be applied to perhaps different cardiology domain efforts and other domain efforts outside of cardiology. So it's kind of going hand in hand with the roadmap you see at the bottom of trying to get cardiology procedure noting extended. So we have still some gaps in the structured heart reporting area, but the biggest gap we see a lot of play here is in the nomenclature, the standardized nomenclature with SNOMED, CT, and LOINC, and lack of having some nomenclature for different areas in the structured heart reporting arena. So we'll be focusing on that in the coming time, but really more importantly, if we look down at the bottom, I'll talk about developing the roadmap first. We really want to get into the planning committee developing a really solid, at least 3-year plan or roadmap for all the different projects we're going to be working on. And what that's going to entail is rejuvenating and bringing back into play the planning committee. So we've seen a lot of participation in the technical side of cardiology, and we feel there's a gap here that we really got to address of getting back on track. So we are looking for new members. So if you're on the call and you really like to make a difference in designing what you think cardiology should look like, and I mean the workflow process of cardiology, how cardiology is going to interact with the different areas of the workflow process, this is an optimum time to get involved with the planning committee in our cardiology domain, because it's an exciting time and we're getting so much participation now in the technical side of a lot of people who really could participate even more wholly in the planning side. And so we're doing a major effort to relaunch what we have for our roadmap, and what we're going to do is probably even a 5-year plan. And once we get through with that, you normally would see a call for papers being addressed here, but we're going to step back, and instead of doing a call for papers right now, we really want to get this planning committee going. And part of that whole process is looking at and writing the white paper for the cardiology roadmap. So that is really what the effort's going to be directed towards. Then the future call for papers will be very targeted for areas we feel are the most needy in the gaps that we don't have standardization. And I think it's going to be an extremely interesting time. If you have time to join the planning committee, it will be a great, interesting next 6 months to a year of really solidifying what our plans for cardiology are and how we can be the most effective. And especially the CPN profile, I think, is an extremely important piece of the workflow process, so we can start moving the data across, like David was mentioning earlier and Paul was mentioning, and we can address things that Japan has to use certain kind of coding schemes with LOINC, and we've used others. So there's crosswalk kind of issues to think about of multiple standardized codes mean the same thing. And so that's what we're really going to be doing in this whole cardiology domain, and I'm very excited about the whole planning side, because I think that's going to be a major, major benefit for all of us here in getting a solid structure for our interoperability needs. And definitely CPN is going to play a major role in that. And there's another ACC committee, I don't know, it might be on the next slide, someone's talking about that. I won't get into it, but if it is, then I'll talk about it later. There's an ACC committee that they formed that is really going to be very valuable, including this rejuvenation project. So that's what I have to say, Paul.
Excellent. Thank you, Nick. And yes, we are talking about that right now. So I'll hand this over to David to discuss our data harmonization efforts within the American College of Cardiology.
Thank you, Paul. And before I even tackle that, I also want to just echo what Nick said, which is if you are listening to this or watching this and have an interest in making a difference in this area, please reach out and join the planning committee, because I think it is going to be an exciting next 6 to 12 months, and we do value as much input as we can get. So on this slide are some of the data harmonization projects that are planned within the college over the next year. First, we will be publishing a paper from our HIT Summit that was held in May at the Hart House in Washington, D.C., which brought together vendors from across the cardiovascular spectrum, clinicians, as well as the college, both ACC and NCDR, for what I think was a very productive dialogue and strategy development. We will also be initiating a structured reporting health policy statement for the EP lab. You may be aware that there are a few health policy statements on structured reporting that the college has published. One is an overview describing structured reporting and its importance for interoperability. And the second paper talks about structured reporting for the Cardiac Catheterization Laboratory. So we will be extending that group of publications to cover the Electrophysiology Laboratory. The next item we'll be working on is clearly defining the data and workflow for the NCDR CAP PCI version 5.0. And we will also be looking at the top 500 cardiovascular data and metadata definitions so that we can get consistency of nomenclature not only across the NCDR suite but beyond. And we will be defining structured reporting data elements for some of the most common cardiac conditions, such as coronary artery disease, hypertension, atrial fibrillation, and heart failure, so that we can indicate which data elements we, speaking for the college, feel should be included for those conditions in inpatient notes, discharge summaries, outpatient notes, etc. So just a few of the items that are planned over the coming 6 to 12 months and beyond. Paul?
Excellent. Thank you, David. So just as a wrap-up here, here's the information regarding the Planning Committee. You are welcome to email any of the three of us. I'm the secretary for both the Planning and Technical Committees. Jerry Serwer or David Slotwiner, co-chairs. We all are open to ideas, and this is definitely a group for the members. So if you've got ideas and drive and energy, we would love to tap that and turn that into work projects that can develop, that we can deliver out to the masses. The Technical Committee, also with Nick and Chris Milo from Philips, we definitely could always use another set of eyes, another pair of hands to make the work go better. We definitely want more feedback from clinicians. We could always use more vendors to contribute their thoughts and perspectives on things. You know, we understand that different vendors have different ideas on things, and to me, that's really the strength of IHE, is the collegial idea and problem solving of IHE. So that's definitely useful. Here are a few of the links to our pages. Definitely, please reach out to me. My email is always open, and I'm happy to answer questions where we can.